a people, it's a community, it's a life, it's a heart, it's a
Ask you
spirit.
a question. The heck would you want a picture of a tattoo of $1,000 on your penis for?
What makes this book so relevant, even though it was written over 100 years ago, is that it's about terrorism.
The work, sex, cars, bars, broads.
And
I mean,
with
anything.
children, it's building on what they have. They have great imagination.
Dementia is not a diagnosis. It's a set of symptoms.
And he kept explaining to me that I wasn't gay, that you cannot be gay. You just cannot.
The main thing is to be open and honest and be, true to yourself.
Right.
Well, good evening and welcome to another edition of Talking About here on QPTV. I'm your host, J.R. Whalen. Our topic tonight is one that has gripped this country and the New York metropolitan area for the past 20 years, and that is AIDS and the spread of AIDS and HIV and the threat it has on society and efforts to curtail it and prevent it. And talking to us this evening are representatives of the AIDS Center of Queens County. And joining us from left to right on your screen are Valisa Green, Luis Ortega, and Judy Pedraza, joining us from the AIDS Center of Queens County. Nice to have you with us.
Thank you.
Good evening.
Thanks for being with us. And we're taking your calls. Also this evening, you can reach us, call us up live here on QPTV. The number is 718-460-9802. Don't be bashful. I'm sure people have a lot of questions, and we want to hear them, and we'll answer your questions as best as we can. So let's start off by, AIDS has pretty much been a topic of concern in our country. Let's see if we can get some water for one of the panelists also, if we can. AIDS has been a topic of concern in this country pretty much since, I guess, the early 80s, about 1982-83, when it first hit the news and first was a major issue in this country. And what you folks do at the center here in Queens County, why don't you, Judy, just start off by describing to us the basics when people walk in the door. What kind of services can they expect, and what sort of education can they expect to get?
Okay, I'd be glad to. Most people come to the AIDS Center of Queens County looking for some assistance, whether it's looking for a case manager who can help them get benefits or housing, or they might have a legal problem, or just some questions about HIV/AIDS. We also have a medical doctor who provides primary care, and we also have a licensed mental health clinic. Sometimes people just walk in the door because they really don't know where else to go. And we try to provide a supportive environment for folks.
Okay, now you mentioned AIDS and HIV, and those are terms that are used very widely to describe the disease, to describe, and I'm sure in many cases it's misused to describe somebody who may have AIDS, who may not have AIDS. The terms HIV positive and negative are tossed around. Luis, just explain for us the difference between HIV positive and HIV negative.
Yeah, no problem. And I think that you're right. I think that we've come so accustomed to just saying HIV/AIDS and kind of clumping the terms together that people often use them interchangeably, but they are different. HIV, which stands for Human Immunodeficiency Virus, is a virus that can be passed from one person to another, that once someone is infected with it, can eventually lead to a condition that we call AIDS, acquired immune deficiency syndrome.
Okay.
And so not everyone who is HIV positive, which means that you've acquired the virus from another person, has AIDS. However, people who have developed AIDS have developed it as a result of being HIV positive.
Okay, so HIV positive is the onset of the disease. It does not mean the person has AIDS as we know it. And what is HIV negative?
Well, HIV negative simply means that a person may have been exposed to the virus, but did not acquire it. The virus did not enter their body. And so if someone gets an HIV test and they get a result that is HIV negative, it means that they do not have the virus, which means that they then cannot develop AIDS.
Oh, okay. All right. So when folks come into the center, they can come in if they suspect they've been exposed to someone who has AIDS, if they have caught it through whether it's sexual contact or whether it's through perhaps I suppose a blood transfusion. If somebody walks in having never been tested, having never really learned a lot about AIDS, and they walk in the door, give us an idea of the kind of steps they take. Who do they meet at the door, and what kind of services do they get right off the bat?
Well, if they haven't been tested, the first thing we would do is have them tested, and they would have some pre-test counseling and come back for their results and have some post-test counseling. And depending on the results, if they're negative, we try to educate them so that they stay negative. And if they're positive, we will assist them to get whatever help they might need.
Okay. Excuse me, Louisa, do you want to step off for just a moment? And
Yes.
okay, just get some water and so we can get some information from you when you come back. So definitely there is testing available. Is it free of charge?
Yes, all the services are free of charge. And we also have a wonderful new program. It's our HIV uninsured program, so that if somebody does test positive and they don't have any medical insurance, or they're not eligible for Medicaid, or they are underinsured, we will assist them to get medical care, all the medications that they might need, and then go on working and getting them other benefits that they might be eligible for.
So there really is no reason for someone to be intimidated by having just any questions about whether they have the disease or is just simply HIV positive. They can walk in the door and there's someone there who is educated but also can provide some kind of a warm, comfortable setting to make them feel at ease.
I think that one of the things we're most proud about at ACQC is the compassionate care that we give for folks. And most people say that they love it. They love to come to the agency because people are so kind and compassionate. And I would say that 99.9% of the staff are there because they've always been the kind of people that have liked to help others or educate others. Another thing, if somebody is positive, it's really important for them to educate themselves about how they can stay healthy and also how they don't transmit the virus to anyone else.
Okay, so there are several levels of education to gain. Not only do you have AIDS and what is AIDS, how does it affect your body, but at the same time, how can you prevent yourself from inadvertently, I suppose, transferring it to somebody?
Sometimes we like to say our site is like one-stop shopping. You can come see a doctor, a counselor, get educated, see a therapist, whatever you might need, in a very open-minded, non-judgmental type of atmosphere.
Where's it located?
Our site is at 9745 Queens Boulevard in Rego Park.
Okay.
We have 2 other sites in Jamaica and Far Rockaway.
Oh, so there are several.
We have 2 harm reduction programs also in Jamaica and Far Rockaway.
Okay.
We have 3 housing programs. Basically, they're located in Long Island City.
We currently actually have 8 sites in Queens, and we're actually opening our 9th office at the end of this month in Long Island City. Yeah.
All right, so pretty much anybody throughout Queens County, excuse me, no matter where they live, have a place to go. Do you have a website where folks can go to find some centrally located information about you?
Yeah, absolutely. Our website is www.acqc.org.
Okay.
And all of our sites would be listed there, and our phone number as well, so people can contact us.
Okay. Valisa's back with us. Nice to have you back with us.
Thank you.
The people there at the center, just give us an idea of their education and how you bring them in and how you bring them into the center.
Excuse me. It really depends on what their needs are. Some people come in because they just want information.
All right, I'm asking specifically about the people who work there.
Oh, the people who work there. Oh, we have all the way through master's degrees.
Okay.
And I guess basically from high school diplomas to master's degrees.
Okay. So the people are very well educated, it sounds like, and they've spent time in the community, I suppose, and they know the community very well. Let's talk about a moment about, we talked about at the top of the show how AIDS has been a hot topic in society for 20 years, and I want to touch on the myths that some people have about AIDS and HIV, how it can be spread, how it is acquired. First of all, let's go to the phones. Remember now, our phones are open throughout the night tonight, throughout the show. 718-460-9802 is our number. We're here with Valisa Green, Luis Ortega, and Judy Pedraza, who are joining us from the AIDS Center of Queens County here on QP TV. And Dan is joining us on the phone right now. Good evening, Dan.
Hi, JR. I love the show. It's a great topic. And I just wanted to ask a quick question. I have a friend who's agonizing over this, and no matter how much reassuring that I give her, she dated somebody who was positive about 5 years ago, and she's repeatedly tested negative since then, and she is very, very much still paranoid over the subject. Is there any literature that I could provide her, or any way that I could steer her to convince her of her safety at this point?
That's not a bad question.
Yeah, as a matter of fact, I was actually speaking with a client of ours today who had unprotected sex with someone that they found out was HIV positive afterwards, and has tested negative since. And so I was actually in that same situation and trying to really give them the information. The reality is, if it can take up to 3 months if someone has become infected for the test to be accurate. So we usually suggest that people wait at least 3 months after the time they feel they might have been exposed to be tested, and that test result is normally accurate. A lot of people are suggested to come back 3 months again to be sure. But if there hasn't been any more exposure, in this case it sounds like it's been 5 years, and if she's continued tested negative, then at this point she's negative, unless she's had obviously any other exposure since that person. But there's no need to continue testing.
Okay.
You know what I mean? Once the test has come back negative, if you want to confirm it again at a 6-month mark, that's normally okay.
All right. So
And we have a lot of information out in our agency that we can provide. You can give us a call, and we'll be more than happy to send it out.
And when somebody comes into the center to be tested or ask questions, I would imagine everything is confidential.
Oh, sure.
Absolutely.
Yeah.
Okay. And you talked about if somebody tests HIV positive. I think the caller mentioned that his friend tested HIV positive and then HIV negative.
I heard it that she's tested negative.
She tested HIV negative. So if they're HIV negative and you don't have a feeling that you were exposed or there's any threat, you can get tested once or twice just to be sure, but now 5 years down the line.
Right. I mean, it sounded like at this point she was still wanting to get tested to find out if she was infected 5 years ago.
Okay.
And that wouldn't be the case. That she wouldn't need to continue doing that. At the 6-month mark, after her last time that she may have been exposed, that test would have been accurate enough, so she wouldn't have to continue testing year after year.
Okay. And it raises some good questions about how the disease is spread. And when AIDS first hit the headlines in the early 80s, there was a thought that you have to be careful because it could be spread by somebody kissing you or whatever. Is that one of the biggest myths? And if it is, what are some of the biggest myths about how AIDS can be spread?
I think that's still very prevalent. We've been talking about HIV/AIDS for 20 years, and for about almost since the beginning, we pretty much know how it's spread and how it isn't. But there still is a lot of misinformation, and people still have misunderstanding about what people with AIDS may look like. And so often people will judge someone's appearance and determine, well, they must not have it because they look healthy. However they determine that to be. And so we know that you really can't look at someone and know. And so there are still myths around kissing. Kissing is one of the questions that I think I confront still on a daily basis. And we know that saliva does not transmit HIV.
All right, so HIV cannot be transmitted through kissing?
No, it cannot.
And through saliva, no? Okay.
I mean, the ways that HIV is primarily transmitted is through unprotected sex, which exposes people to vaginal fluids or semen, and sharing needles, which is quite often through intravenous drug use, which exposes people to someone else's blood. Those are the really two primary ways that HIV is transmitted. Early on in the 80s, there was a lot of transmission going on because of blood transfusions. But since 1985, we've been testing the blood for HIV, and obviously any blood that's test positive isn't used. So that's really not a huge risk factor anymore either.
Okay.
And the virus can be transmitted from mother to baby.
It can?
Yes.
Okay.
Although now with all the medications, we don't see that very often.
Okay. All right. At the center, how long have you been in existence, first of all? Anybody can answer.
1986.
1980.
All right,
1986
so you've been there for 18 years.
Yeah, a group of concerned people from Queens who were seeing a rise in the epidemic, not only in Manhattan, but in the rest of the boroughs, got together and, formed the AIDS Center of Queens County in response to serving the particular needs of the Queens community.
Since you opened up in '86, how have you seen the spread in the New York area, the spread of AIDS? How have you seen it rise and fall? And how have you seen the education of the public change as well? Anybody can answer that.
Well, I definitely believe it has risen since.
What has risen?
Okay, the outbreak.
Okay.
Okay, of HIV being passed, and through the need, we've added more education because education is the only way of actually helping people not acquire HIV.
So knowledge is power.
Absolutely.
Okay.
It's part of it. I mean, I think that also, that it's definitely the foundation, and so we provide a lot of that education. And the other piece is support, because knowledge sometimes doesn't translate into behavior. A classic example is smoking. Everyone knows the health risks of smoking, but people still smoke. You know what I mean? And it's the same with HIV, that there are challenges. People know how HIV is transmitted for the most part. It's pretty common knowledge, but people still have unprotected sex. So there are other forces at play that make it difficult to practice safe behaviors. And so we give the education, which helps empower people to change behaviors.
Okay. Well, we're here on QPTV, speaking to folks from the AIDS Center of Queens County here on Talking About. Our phone number is 718-460-9802. And I think we have someone else on the phone with us right now. Johnny is joining us on the phone lines. Good evening, Johnny.
Hey, Katie.
We
Come
hear.
here, listen to me.
Hey, Johnny.
Come here, hurry up.
We hear Johnny. Sounds like there's something going on.
Come here, Katie.
Back at home. Johnny, are you there? Or Katie,
Hello?
for that matter. Hi, Johnny.
Yeah, how you doing? I can
Very
hardly
good.
hear you.
What's your question for us?
Yeah, my question is, every time I go to the dentist, I'm always concerned about the instruments that they use, and I'm always concerned, if they're sterilized. I was wondering, is it possible that a person could get infected through the instruments that a dentist uses?
Good question.
It's actually a really good question. Obviously with the spread of not only HIV, but a lot of other diseases that can be spread from one person to another, but more once HIV came on board, more stringent laws were put into place in places like dentist's office, doctor's office, acupuncture settings, so that it is required that all equipment be sterilized after each use. And so we don't really see the spread of HIV happening in places like dentist's office or any other medical facilities, because those policies are in place to protect the patients who visit those locations.
Okay. Any more questions, Johnny?
No, I was saying, but is it possible for that to happen if the instruments are not sterilized?
In theory, it is possible. I mean, anytime that someone's body fluids can get into another person's body, obviously then there may be a risk. So, I mean, there's a lot of ways that, kind of in theory, it can kind of happen, but we don't really see that happening in real life because people don't behave in those ways. So if a dentist or any other sort of medical professional was not properly sterilizing their equipment and was to use it on someone else, then there may be a slight risk of transmission happening. But again, I don't want people to think that that is common, because it really isn't. It really doesn't happen.
So you go to the dentist, and I guess a good thing to do is to look for the dentist to be wearing gloves, a fresh pair of gloves when he or she works on you, and then oftentimes you see the tools that they use, they take out of packaging that's been sterilized. So it's not just been in sterile liquid, but in fact it's in shrink-wrapped cellophane or some kind of packaging.
It hasn't been used before.
Okay.
Absolutely.
So it's good to look for that.
I think it's also good just to ask questions if you have any doubts.
Okay. All right, Johnny, thank you very much.
All right, thank you.
All right. Brings up a good question, because I think that 20 years ago and before that, not that I can recall, I didn't recall seeing dentists wearing gloves or there being such an awareness. And it makes total sense, whether AIDS was on our minds or not. It's just good to keep everything germ-free, and it seems like it has just given us a heightened level of awareness about keeping things sanitary and clean in places where they should be.
Absolutely.
Everyone is supposed to be practicing those universal precautions and using rubber gloves in any type of a setting. I have friends that work in a nursery school, and if the children throw up, they have to put on gloves to clean up. And I would say if you go to a dentist and they're not wearing gloves, you might need to go to another dentist.
Yeah, that's a good idea. That's a good idea. So you go into the community and you educate folks in the community. You talk to all ages. We talked about that before the show. Tell me some of the experiences you have in talking to children. How educated or how open are they to information about AIDS and the threat of it?
Well, I've been in schools, and I'm amazed at how bright the children actually are. They seem to know a lot about not only HIV, but other STDs as well. And I'm talking about children as young as, I'd say about 13, okay? They know a lot. Their misconceptions come in with things like wearing 2 condoms, okay? If you wear 2 condoms, you're definitely going to have a problem because the friction of the 2 condoms, one is definitely going to break, if not both. So that's like their biggest misconceptions. And the other thing is that they say, I can't tell that this person has HIV. And I asked them, well, what does HIV actually look like? And nobody had an answer. So it was like, okay, well, maybe I don't know what it looks like. Maybe I need to be a little more careful. And I enjoy when they ask that question specifically so that they know. They don't know what it looks like.
And like you said before, you can't tell by how someone looks whether they're afflicted with it or not.
And I think that, you know, in the 80s when we were seeing those really horrible images of, you know, what AIDS patients were experiencing, and it was real. And, you know, the reality is that it still is real, that people get HIV. HIV is not a curable disease, and it can have very serious health effects, including death. And so people still who are in advanced stages of the disease do look very sickly. However, it's not most of the people. Most of the people are doing well. They are healthy. They're not showing any outward signs of being sick, may or may not know they have HIV, or are on treatments, and the treatments are working very well for them.
That's what I want to talk about in just a moment, are the kinds of treatments that are out there. You said there's no cure, but there certainly are treatments and drugs on the market to help to curtail it or to help to curtail the effects of AIDS. But in the meantime, let's remind you that our phones are open. 718-460-9802 is our phone number. We have folks joining us tonight from the AIDS Center of Queens County right here on QPTV. And Vito is on the phone with us this evening. Good evening, Vito.
Good evening. How are you?
Very good. How about yourself?
Okay, pretty good. I would like to ask the panel a question. It's kind of a simplistic question, but what about the mere act of kissing? Like, in other words, one person kissing another one on the lips. Can the AIDS virus be transmitted through that? Or what other sexually transmitted diseases can come about just from the simple act of 2 people kissing each other, male, female, female, male, whatever the case might be, you know?
Well, we touched on that before. You said that AIDS cannot and HIV cannot be spread by kissing.
Right.
However, if someone has, let's say, a cold sore or some kind of a sore on or inside of their mouth, does that increase the risk?
It's hard to say. I mean, because really most cold sores aren't emitting blood, right? I mean, we are talking about HIV is spread through body fluids. And so it really needs to be some sort of behavior in which the body fluid of someone is really getting into the body of another. And so with HIV, we don't really see it being spread, whether it's through tap kissing or even French kissing. Anytime, however, that there is opening in the skin, a cold sore, whether it's on the lips or, you know, inside the mouth, it may increase the risk of the person with the cold sore if they were to get blood in their mouth or semen or vaginal fluid in the mouth during oral sex. So their risk would be increased by having a cold sore. And I know that it's often confusing because there are other STDs that are spread easier. For example, herpes. You know, if someone has herpes and they have a herpes sore on their lips, you can get it by simply kissing. But HIV really is not spread in that manner.
Okay. Vito, any more questions?
No, it's just that nowadays you got to be so careful. It makes you think twice about doing almost anything, and it makes you think that before you do anything with anybody, you really got to check them out. I don't know how, without demanding that they go to a doctor with you to get themselves checked out. You meet somebody at a social occasion. It's not like years ago where you could meet somebody and then next thing you know you're in the backseat of a car somewhere. You got to think twice and 3 times about who you meet and what you do with them, and you got to sort of do a little investigation about their background almost before you get intimate with a person. It's kind of sad in a way, but I guess that's the way we're living now, you know.
But Vito, I think he brings up like a lot of really great issues, you know, that we can probably talk about forever. But I did want to, because I think it is important that, you know, one of the things that we also encourage people is that you talk about it. That you know, we are living in a time when there are, and not only HIV, but you know, syphilis and gonorrhea and chlamydia still exists. You know what I mean, and can be spread. That people have conversations with their partners, with their sexual partners, and speak open and honestly about your fears, your concerns. If it's a relationship that you feel like pursuing, you know, that people have these conversations, and quite often that's not happening.
Right.
And if it's a one-night stand and you don't really want to have that kind of a conversation, that's okay. The important thing to know, I think, is that HIV is preventable. You know what I mean? And so if you do meet someone and you decide to go to the back seat, that if you use a condom, then you know what I mean. You are doing what you can to stay safe. You know,
you're
what I mean?
decreasing the risks right
Absolutely.
off the bat.
Yeah,
Okay.
tremendously. You know what I mean. So it's really about personal responsibility of staying healthy. You know what I mean. So and so people need to practice safe sex and do things that are going to keep them from acquiring the illness that you know can be harmful to them.
What are the threats of oral sex? How can people prevent? What kind of precautions can people take to try to prevent the spread of AIDS?
Well, in reference to that, we have, okay, in terms of oral sex, now when it's a female having oral sex performed on her, we have something called dental dam, which is the same thing that the dentists use usually when they're giving a root canal. If you can't get to dental dam,
And you have one here.
Yeah.
All right.
Yes, please pass around.
Let's definitely take a look.
Here comes the goodie box.
We love guests
It's
that bring
gonna
us.
it's gonna get real interesting now.
That's why we're here. That's why it's cable TV.
Okay, I'll find it for you.
Okay, if you don't have dental dam, okay, saran wrap works just as well
Oh, is
to
that right?
prevent the transmission of bodily fluids from the vagina to the person's mouth or vice versa.
Okay.
Okay, now this is a dental dam, okay, and it doesn't look very big, but it stretches, and it's latex, okay?
And that is.
It's non-porous, so nothing can be transmitted through it. Okay,
And is
it's to be used one time.
Is that latex?
Yes, it is.
And how exactly is that used?
It's taken and it's laid over the pelvic area, okay? And then oral sex can begin because then there's no way of the fluids that are here getting in contact with the person who is having the oral sex.
Okay.
So it creates a barrier between the mouth and the vagina, so that the vaginal fluids don't go into the person's mouth.
I see. Okay.
And the person's whatever's in their mouth will not go into the vagina either.
But it doesn't prevent the sensation associated with oral sex.
Oh
Is that
no,
right?
it's very thin. It's very, very thin. Okay? It's very, very thin.
And that's available at any drugstore?
Actually, generally, I think they would be at probably more specialty drugstores. But as I said, you can use saran wrap.
Okay.
Okay, and that's a household item. Okay, that generally can be kept in the house and not be out of the ordinary for anyone.
Right.
And if folks have any questions, they can always come by any of the centers.
They can come
Oh,
by and we
definitely.
even give them out.
Fantastic.
And people, when they first look at it, they feel very uncomfortable and they say, oh, I'm never going to use that. But just with a little education and instruction, people start to feel a lot more comfortable.
Okay.
And I think that, I think that one of the realities and what we try to validate for people is that, it may seem really strange to use, you know what I mean? That it's not the same as just having oral sex without protection. But we also have workshops where we show people how they can still have excitement and pleasure and be safe. So there are techniques that can be used. There are gels that can be used, with the dental dam to help increase sensation.
You mentioned gels, KY jelly versus Vaseline.
Right.
Which is the more effective as far as preventing?
KY jelly.
Okay.
Yeah, don't use Vaseline. And it's actually a really good comment because, for many years, Vaseline was a common household product that was often used for sex. However, Vaseline is oil-based.
Okay.
And oil breaks down latex, which is what dental dams and condoms are made out of.
So the water in the Vaseline can actually work against the material in the condom or the dental dam?
Oil.
Oh, the oil.
Yes.
Okay.
Yeah, Vaseline, things like Vaseline, baby oil, Crisco, any kind of oil-based product that often people use for extra lubrication are not safe to use on latex condoms. And so there are other products such as, this is something called Rain, and it's a water-based lubricant,
All right,
or KY jelly.
So
which is more
KY jelly
common.
is actually the brand name, kind of like how Band-Aid is a brand name.
Right.
But the actual, so you walk into a drugstore, let's say, or you walk into to your center, and you could either ask for KY jelly, or you just mentioned before, you call it a water-based lubricant?
Yeah, any water-based lubricant can be used. Now, in a regular pharmacy, what you're going to find is KY jelly.
Okay.
It is the most common one. They buy it. It's on the counter, so you just pick it up and pay for it. But they do come in flavors and colors, and usually you can find those more in specialty shops that are located. Many of them down in the West Village, right?
Okay.
Kind of erotic shops. But KY jelly works just as good. Anything that's water-based. And you could ask the pharmacist if you have questions about what is and what isn't.
Okay, we have a lot more props to look at as we become educated throughout the hour here on QPTV. Our phone number is 718-460-9802. We have another caller on the line for our friends from the AIDS Center of Queens County. Renee is joining us on the phone right now. Good evening, Renee.
Hello.
Hi, how you doing?
I'm good. I just wanted to know, can you get HIV from blood transfusions like we did in the start of the epidemic? Is that still possible?
It really is such a low risk at this point that statistics are barely even kept anymore.
So I guess, as you said before, in theory it's possible, but the awareness in the blood transfusion process, I guess, is so controlled now.
Well, there's two things that have really kept our blood supply safe from HIV. One is that any blood that is donated is screened for HIV. And so obviously if they find HIV in it, it's not used. Or any other STDs, they screen blood for a lot of different viruses. But the other, and prior to donating blood, there's a pretty intense screening process, which became really essential and necessary once HIV came on board. So when you go to donate blood, anyone who's donated blood in the last 15 years knows that they're asking you a lot of questions before they even take your blood. Questions like, have you had any unsafe behaviors? Stuff about your background,
Have you
history
traveled
of
out the
drug
country?
use, where you've traveled in the world.
So in addition to the questionnaire, then the donated blood is tested.
Absolutely.
Okay, so there's really no room for error.
Right. I mean, the questionnaire is used to really screen out people who may be HIV positive, and so often a lot of people their blood isn't even drawn because they don't pass the screening process.
Okay.
If their blood is drawn, then that blood is tested for HIV.
And somebody out there who's concerned about giving blood, is there a threat for those donating blood that they could acquire the illness?
No.
Okay.
They use sterile. Everything is sterile when you go to donate blood.
Okay.
And so a new needle is used for each person donating blood. Right?
All right. Renee, thank you very much.
Okay.
All right. Let's see what else we have in our props here. We saw the KY jelly, and we saw the dental dam. And I'm sure that these are things that folks in our audience have certainly heard about, but maybe have not seen before.
Well, I mean, you know, one of the things that I was going to mention before in terms of oral sex, you know, Valisa gave a great example of how to use a dental dam if you're having oral sex on a female. And I will kind of preface this by saying it really doesn't matter who's involved, man or woman, two men, two women, 3, 4, 5 people of whatever combination, that these things can be used to help prevent the spread of the virus. And so oral sex on a male, you can use an unlubricated latex condom. So these condoms are specifically made for oral sex. There's no lubrication on it, it's dry.
So non-lubricated condoms
A non-lubricated condom are designed for specifically for oral sex.
Okay.
That way, obviously, once the condom is on the penis, the person who is using their mouth doesn't have lubrication in their mouth. It's just a dry condom. So this is a good way of preventing oral sex if you're having oral sex with a man.
Okay.
Or with having anal or vaginal sex, then we'd want to use a lubricated condom.
That's a good question. We talked about vaginal sex, but also a widespread issue is anal sex. Perhaps, correct me if I'm wrong, does that represent the highest risk? The people engaged in anal sex, does that put them most susceptible to the risk?
Anal sex is considered to be a high-risk behavior, unprotected anal sex.
Okay.
You know, for many years, one of the messages that was put out there was practice safe sex no matter what you do. And that is still a message and it's still accurate. But we do know that the HIV transmission or the rates that HIV is transmitted is lower through oral sex than it is for anal sex. So there's still a risk no matter which way or what sort of sexual behaviors you're engaging in. But anal sex definitely transmits the virus easier if it's unprotected. So definitely for behaviors like vaginal and anal sex, we do support and encourage people to use condoms each and every time that they're going to engage in that behavior.
Okay. Are you open 24 hours a day?
No.
Okay.
You wish.
Generally, we're open from 9 to 9.
Okay.
On Wednesdays, we're open from 9 to 8, and Friday, 9 to 6. That's the Rego Park site. But the other sites have hours very similar.
When, you know, I read something at one point, and it said that before engaging in oral sex, you should not brush your teeth. You should not floss. Is that a myth, or is that because the thought was that you could cause a little bit of bleeding in your gums? Is that a valid concern?
Anytime there's a possibility of blood being present is a concern. And so we know that if someone has sensitive gums, gingivitis, that it's quite often, you know, and most of us have brushed at one time or another, and there's a little bit of blood, right? It's not that big of a big deal, but yeah, you want to avoid having any sort of blood being present during any sexual encounter with people, and so you may want to not necessarily, you know, floss.
Okay.
You could brush your teeth.
Right. I
So
mean,
if you know that your teeth or your mouth are particularly sensitive to flossing or brushing, then do it after you have oral sex so that there's no threat whatsoever of there being any blood in your
right, because
in
then
your
there's
mouth.
a possibility of there being blood in the person's mouth. And if then they are having oral sex on whether it's on a penis or a vagina, then they are exposing their partner to their blood.
Okay.
And so we obviously want to avoid that.
All right. And our phones are open for you throughout the show today. 718-460-9802 is our phone number. Joining us are representatives from the AIDS Center of Queens County. From left to right, Valisa Green, Luis Ortega, and Judy Pedraza are here joining us here on Talking About on QPTV. And Cynthia is joining us now on the phone. Good evening, Cynthia.
Hi, good evening.
Hi.
How are you?
Very good.
I have a question. Went to one of the city agencies and I took an HIV test. And the counselor was describing HIV-1 and HIV-2. And I'm still not clear what's the difference between HIV-1 and HIV-2. I was forced to test negative. But when I asked for my results they documented HIV negative 1, and then I proceeded to test negative for HIV 2. And I'm still not clear. The person did say that I was negative, but did not document negative for HIV 1 and negative for HIV 2. I would like to know the difference between both of them.
All right.
Great question. A lot of good questions tonight. There are two main forms of the HIV virus, and they are classified as HIV-1, which is the strain that we see most common in the Western Hemisphere in the United States. There is an HIV-2, which is an HIV virus, but we don't really see, that virus is not common in the United States. HIV-2 is most common in Western Africa. And so in areas, in that area of Africa, you have a lot of people who are infected with HIV-2.
So it's a different strand of the virus. Is that the best way to describe it?
Yeah, it's a different form of the virus. And so in the United States, when you get an HIV test, you're being tested for HIV-1, which is the HIV that is common in this part of the world.
You mentioned Western Africa. That's how it arrived in this country in the early 80s. Is that correct? It somehow came from Western Africa to this continent?
I don't think that anyone really knows how it traveled from continent to continent. I mean, there's a lot of theories. I think that, there's theories that it was made in a laboratory somewhere in this country. I mean, people really have a lot of different ideas as to where HIV came from and how it may have come to the United States. There are theories of how it may have evolved from similar viruses that we see in simians. But I have concerns about necessarily saying it originated in one place, because I think it also causes a lot of stigma, in addition to the normal stigma attached to HIV/AIDS. And we don't really have concrete evidence of any sort to say that it originated in Western Africa or for any other part in the world for that matter.
Okay. We talked about earlier how in the community you educate children, teenagers as young as 13, and then I'm sure you talk to folks in all age groups, all the way up the spectrum. What do you find about the spread and the education among different ethnic groups, whether it's Latinos, whether it's African Americans, or white or Asian? I'm sure that AIDS doesn't discriminate among any age group or any nationality, but as far as the spread, what's been documented about the spread among different nationalities?
I can do that one as well, I guess.
Okay.
We have seen, there's a lot of things to consider when you're looking at the trends of HIV, right? Where do we see the HIV epidemic going? We know that in the early 80s, we saw high rates of HIV amongst white gay men. Not all gay men, white gay men. And then we identified it amongst intravenous drug users. And I think it's important to note that at the time, I mean, we know now that HIV can affect anyone who's engaging in those behaviors we discussed earlier.
Doesn't matter really, what color they are, doesn't matter where they come from.
Your gender, your color, your race, your ethnicity, your sexual orientation. If you are engaging in a risk behavior, you are susceptible to getting the virus. But early on, there was a lot of stigma attached to the virus. Only certain people were even being considered to get tested. And so, of course, we saw high rates in those populations. I think one of the unfortunate things that happened early on in the epidemic is because it was placed sort of in certain communities, and other communities felt it wasn't their problem. But it was always their problem. And so today we see high rates amongst people of color, African American and Latinos. We see increasing rates amongst women. And today HIV is actually spread more commonly through heterosexual contact than it is through homosexual contact.
Really?
Well, part of it is, the gay male community really mobilized early on in the epidemic to educate themselves and to begin practicing safe behaviors, while everyone else who was susceptible felt it wasn't their issue. And so throughout most of the 80s, unless you were gay, you didn't think HIV was your problem. But it was. It always was. but those messages were not being put out to the general population in a way that could have stemmed the epidemic. And so people of all backgrounds, sexual orientations, race, ethnicities, genders, were becoming infected throughout the 80s, while gay men were beginning to practice safe sex and start taking really care of their health. And so then we start seeing the shift into the 90s and into the new millennium.
We also see now a lot of interest from different church groups, and there's a big push now from faith-based organizations to educate people in their parishes and temples, which is something very new.
That's fantastic. We have another caller on the line. Joining us now tonight is Karen. Good evening, Karen.
Hello.
Hi.
I would like to see if someone there could demonstrate some of the different kind of protections that they have besides dental dam. I have a few young people in my house that I would like for them to see that there's other things besides Trojans and stuff like that.
Great. All right, we'll do that for you right now.
Thank you.
Well, one thing we have is something that may not be known about very well. It's called the female condom. It looks very different from a male condom. Okay. This is how it looks. Okay? Now, in order to insert a female condom, this is going to be the vagina. What you do is you take it and you pinch it and you squeeze it all the way back, and this as far as you possibly can. And then there's the pelvic muscle. Oh, one other thing. If you've got long fingernails, you might want to be careful. Okay? This is the pelvic area in the back, and then you pull it, and it will become solid, and it will be in place. It will not slip out, and at the ring, you must always make sure the ring is fully flush against the vagina, so that way you know that it will go, the penis will go directly in, not on the side, and will not squeeze it in because that will defeat the purpose.
Now, the material that's made of, was that also latex?
This is polyurethane, okay? Polyurethane is 40 times stronger than a latex condom.
Wow.
And as with all condoms and dental dam, it's for one use only. You use it, you discard it. We also have, where'd they go? Okay. Something called a finger cot, okay? Forgive the nails. The finger cot, oh, okay, good, do this.
It's called a
finger cot.
A finger cot.
C-O-T?
C-O-T.
Right, and you can see that the finger cot looks like a very tiny condom for the most part.
Yeah.
It's made out of latex, and it is to be placed over the, quite often if women are getting their nails done, or your cuticles, the edge around the nail bleeds sometimes, or people who use their hands in their jobs and they're constantly getting nicks and cuts on their fingers. This is one way of protecting the finger, or not only from having body fluids get into any cuts on your finger, but if your finger is bleeding for whatever reason. And so you would put it on the finger much like you would put a condom on a penis. You just roll it right over the finger, and so any sort of openings on the finger are not exposed to body fluids.
Okay.
And these things, I think, people have become very creative post-HIV, you know what I mean? That when two people are trying to excite each other, be intimate one another, and give each other pleasure, that it's not only about a penis and a vagina, it's about the hands and about your tongue and about a lot of other body parts. And so things have been developed and created so that people could continue to use their fingers and hands and other things and still be safe.
Okay.
And the finger cot is one of those examples.
And Valisa has another prop there.
This is the standard latex condom for males, okay? When you're using the condom, you make sure you pinch the tip. After you take it out, you you hold it, okay. Slide it down. I'm sorry, let me do that right. Okay, now, okay. You pinch the tip, you put it on, and you just slide it down, okay? But you always make sure that you pinch the tip, specifically so that the air is removed, because if you don't pinch the tip and the air is not removed, it can possibly explode after ejaculation. And in order to remove it, what we do is we slide it up to the front, pinch it off around the head, twist, pull it off, and then you knot it so that the fluids, okay, do not come out and does not get on either person. Okay, and then you can discard it.
One use only.
One use only,
And-
always.
Yeah, and I'll just add, I don't know if you can see this good on TV, but these things do come extremely lubricated. So, like, I know your hands are all shiny at this
Yes,
point.
they're shiny and
We can
slippery.
get you a napkin.
Thank you.
So these things do come lubricated so that there's less friction between the two partners. Friction can cause the condoms to break. And so we want to reduce that. So the condoms do come lubricated. If you need extra lubrication, you can use water-based lubricants.
Except on the female condoms. The female condoms must have silicone lubrication.
I wanted to add something about the condoms. You have to be sure to check the date.
Oh,
because
good
they
idea.
do have an
There's an
expiration,
expiration
date.
The expiration date you can generally find right on the back. Okay? Generally, they will print it so you can actually see it, but sometimes you can't, but you always need to look. And if you're in doubt, you can always just kind of pinch it. There should be some air still inside of it so that you know that it's fresh and it's usable.
So
but
if
always check the date.
If a condom is not fresh, let's say the expiration date is January 04, and let's say it's October 03, and now we're in February 04. Would the material start to break down the actual surface of the condom?
Yes.
Okay.
Yeah, I mean, the closer to the expiration date, the higher likelihood that latex is that the condom is going to break.
Okay.
Latex isn't, doesn't last forever.
Mhm.
And like food and like a lot of things that have expiration dates on them, the expirations are there to signal or to advise the consumer of when it's good to use and when it's not good to use. And if you have an expired condom, you need to discard it and get one that isn't expired. And that's, I think, important. I know, and I think maybe still today, but back in the days, a lot of men carried condoms in their wallets. You know what I mean?
Yeah.
And by the time they got to use it, or adolescence, in the hope of using it one day, the condom expired. In the year they had it in their wallet, and then the condoms break and they're really ineffective.
Does the female condom have an expiration date also?
Yes, 5 years after the date of manufacture.
What's the range of dates for the male condom?
The range of dates for the male condom is about
I
7 years.
think it's 7 years from the time that they're manufactured.
Oh, okay.
Yeah, so they do have, they do have a long life, a long shelf life. And I would say if you have a condom that has an expiration date, at this point, if any expiration date prior to before 2005, since we're in 2004 now, that condom's been around for a couple of years already. So you either have no use for it, or you should just go and get a fresh batch. You know what I mean? They're inexpensive. You can come to ACQC. We give them out for free. We're more than happy to do that. And the condoms are usually have an expiration date of at least 4 years. The condoms we're distributing now expire in 2007.
Okay. We have one more phone call. I just ask a question. Someone who has never been exposed, let's say somebody who has not had intercourse before, is having sex with someone who has not been exposed to AIDS. I want to make sure that, is there a threat of AIDS? Is there a threat of the spread of AIDS if someone has not been exposed? If someone has unsafe sex, and let's say they have unsafe sex with someone who has not been exposed to AIDS, is the threat there anytime they have unsafe sex?
I want to understand your question.
Let me see if I'm asking this correctly.
So, let me rephrase it for you. And we'll, if neither of the partners have HIV,
yes,
is there a risk of getting HIV? The answer to that is no.
Okay.
In order for HIV to be transmitted, one of the people has to be HIV positive.
Okay.
So, which means that they have the virus. So, if two people are intimate and they know for sure that each of them are negative, they may make a conscious decision not to have safe sex, knowing that there's no risk of HIV transmission. I mean, for example, people want to raise families, right? You can't, if you want children, you can't use a condom.
Right.
You know what I mean? And so, if both partners know that they're HIV negative, and a lot of people come to our agency with their partners and they get tested together.
Oh, okay.
And then they decide that they're going to be in a monogamous relationship, then they each know that well, I'm negative, you're negative. If we choose to have unsafe sex, there's no risk of HIV. There may be a risk of an unwanted pregnancy, but HIV wouldn't necessarily be a concern.
About 2 minutes left. We have one more phone call. Mary's on the phone for us tonight. Good evening, Mary.
Good evening.
Hi.
And I just want to say that I think this is a great subject, and it's a very important one. And I was wondering how one could volunteer.
Wow, that's the question of the night. How can folks take part?
We're always looking for volunteers, and all they have to do is call, and we'll have them come in and have a little interview and see what they might be interested in doing.
What's the phone number?
It's 718-896-2500.
Okay, 896-2500, 718 area code. Of course, you can go to their website, acqc.org, and they'll get you all set, because I'm sure that, you know, knowledge is power, but the more bodies you have spreading that knowledge is worth its weight in gold.
Yeah, and I'll just, you know, I'm excited that we even had one person call asking about volunteering. You know, we are dealing with an epidemic. It's an extreme public health issue that concerns all of us, and that we are always looking for people to help us out. And our department, I'm the director of education, and we use a lot of volunteer paraeducators, people from the community who are concerned about their community, their daughters, their partners, their friends. They get training with us, and they go back out into the community to talk to people about HIV/AIDS and how they can protect themselves. So we're always looking for people to help us in the fight against HIV. Absolutely.
And the fight will just continue to go on, and you just hope that folks are more and more knowledgeable.
Absolutely.
Any more props we missed along the way?
Actually, no, I think we covered pretty much everything.
Okay.
I would like to add that we brought along some needles to show people how to clean them. I don't think we have the time for that, but just so people know, we do have a program where if you need clean needles, you can come in and get them. No prescription, no questions asked.
Everything's confidential.
We have a place where people can drop off dirty needles as well.
Yeah, so I mean, today we concentrate on safer sex, but obviously we know that sharing needles is also high risk. And so there are several ways of preventing that as well. And one of them is by using a clean needle each and every time you use one, whether it's, you know, steroids or heroin or diabetes. And so you can get free needles from our agency as well.
Okay, and to get involved, give them a call, 718-896-2500. Want to say thank you very much to Belisa Green, along with Luis Ortega, Judy Pedraza from the AIDS Center of Queens County. Here on QPTV, I'm J.R. Whalen. Thanks for joining us here on Talking About. Have a good night.